Hi everyone, I'm Dr. Niranjan, consultant nephrologist and specialist in internal medicine. Today I would like to enlighten you about the term Bendopnea. So what does it mean? It means that any person who feels shortness of breath or breathlessness when bending forward within 30 seconds, we call them as suffering from Bendopnea. So, what does it need to be worried? Definitely yes, because it may be a manifestation of hidden or ongoing heart failure. So it occurs because of increased filling pressures in the heart and also decreased cardiac index. Dr. Jennifer, who has done a study on this among one or two patients who have been subjected for a right heart catheterization, she observed that around 28% of these individuals will have symptoms of bendopnea. And also, they at the time of discharge from the hospital, when they have been decongested, the symptoms of bendopnea have come down. So these symptoms needs to be addressed, and any person who has the symptoms need to be investigated to evaluate for the heart failure. And this is seen around 7% of the general population. And also, you need to keep it in mind that there are some individuals even suffering from the respiratory disease like the allergic bronchopulmonary aspergillosis, OSA, obstructive sleep apnea, and also people who have pulmonary hypertension may have this symptom. And you need not confuse with the symptoms that anybody who bends forward feeling of heaviness in the head, neck, or fullness in the head or neck. You should not confuse with that. That may be a feature of mild compression of the neck vessels, and that may not be bendopnea. That is just a feeling of heaviness or lightheadedness when they bend forward. So only we need to worry about when they bend forward within 30 seconds of that, if they feel breathlessness or shortness of breath. Most of the time, these symptoms are observed when they're tying the laces of their shoes or putting the socks or praying for the God. They may feel this symptom. And when we examine the patient as a doctor, many times we look into the jugular venous pressure. If it is elevated, it may be a sign of right heart failure. So this symptom may be equated with a jugular venous pressure. Many times when we face a difficulty in measuring JVP, we can take this symptom of bendopnea, which is equal to the raised jugular venous pressure. It occurs because of the increased filling pressure in the heart, especially when the pressure is more than 22 millimeters of mercury, and when there is a down of cardiac index that is less than 2.2 liters per minute per meter square. And so that is the case, then you have to consider that patient has a features of a significant heart failure. Around 15 to 20% of the compensated heart failure patients will have this symptom, whereas around 48% of the decompensated heart failure patients may have this symptom. So we need to give importance for this symptom of bendopnea when they present to us, and we need to diagnose the feature of heart failure early, and we can avoid the complications of heart failure during our management protocol. And this will coincide with the cold and wet phenotype of heart failure, that is the underperfused and congested feature of a heart failure. Thank you very much for patience listening.